Okay, we were talking about all this ATP that you got to make, right? Well, let me show you why. All over your body, you're needing ATP for everything to work, right? In your skin, you need ATP to make the skin cells, okay? And to constantly turn over those skin cells. Skin cells are turning over all the time. This is why, this is why you need to launder your sheets, for instance, in the bed. Or let's say you take a shower, and if you don't clean the shower, clean the tub, you get a ring around the shower. It's because of all these skin cells that are sloughing off. Okay. This is why it's important to exfoliate, but you don't want to over exfoliate. We need ATP for skin to grow, to have nice, healthy skin. If we don't have enough ATP because you're in a state of disorder, a state of dis-ease, in other words, you have a disorder or a disease, now your skin, how's it going to be? Your skin's going to be dry, itchy, flaky, right? Think about it. In a chronic situation, how many patients have just beautiful skin? No, most of the time their skin is dry, it's itchy, flaky, because we don't have enough ATP to power up these skin cells because we're having to feed other disease cells. What happens in the hair? We need ATP to make the hair grow. If we don't have enough ATP, the hair is going to be brittle, it's going to be dry, it's going to fall out, it's going to start thinning. We may have hair loss. Hang on. What happens to the nails? In order to have nice, healthy nails, we need, let's say for those cuticles to grow, for instance, and the nail to elongate, we need ATP for that. By the way, what vitamin would we need for good hair, skin, and nail growth? Okay, that's going to be things like biotin, so vitamin B7, for instance. Oh, by the way, what would interfere with vitamin B7 or biotin synthesis? So that's going to be, for instance, avidin. Avidin is one of those things that's found in raw eggs. So bodybuilders who consume raw eggs like in a shake, they have to have a lot of them. But let's say they do this every day. They're consuming a whole lot of raw eggs, for instance. It can actually interfere with biotin absorption, and now it can affect, for instance, their hair, skin, and nails, okay? We also need ATP in the GI tract for nutrients to be absorbed. So this is exactly what happens, for instance, in Crohn's disease. You don't have enough ATP to power up the healthy cells along the GI mucosa, and now nutrients can't be absorbed. So now they're going to have things like nausea, vomiting, diarrhea, right? Okay. For instance, I'm going to come back to respiratory tract. Let's go to uterus. Okay. In the uterus, well, we need ATP, for instance. Let's say that throughout the menstrual cycle, under the influence of estrogen, we need the endometrium, for instance, to proliferate, to get thicker in preparation for pregnancy. Obviously, if there's no pregnancy, if there's no implantation, the endometrial layer gets sloughed off every month, and that's what happens during the menstrual cycle. Well, if we don't have enough ATP, that whole process can't work. So it can lead to things like secondary amenorrhea, for instance. So you may have started with one condition like Crohn's disease, diabetes, hypothyroid, lupus, and now you've got secondary amenorrhea just because you don't have enough ATP. All right, what happens in the breast? In order for the breast, especially the ducts, to grow, or let's say for lactation to occur, we need ATP for that. So what happens in the breast is the breasts undergo atrophy. So the breasts get shrunken, they become dense, they become fibrotic. You don't have as much fat tissue in the breast. What happens in the testicles? Similar process. The testicles undergo testicular atrophy. The testicles also become shrunken. So now you're not able to, for instance, produce as much sperm. So, for instance, this can lead to sterility. Same thing with the uterus. It could lead to sterility. So you can have all types of reproductive disorders just from a lack of energy. Okay. Now, when it comes to the kidneys, Well, we need ATP for things to be absorbed or secreted. If we don't have enough ATP, the things that are supposed to get absorbed don't get absorbed. The things that should be secreted don't get secreted. So, for instance, let's say you were supposed to get rid of some waste, but you don't have enough ATP. It can now back up, and now it can lead to things like bladder infection. So, I want to pick up the story from there. The reason these two are highlighted in pink is in any chronic disease, you're likely to have two types of infections. You're predisposed to, for instance, respiratory tract infections and urinary tract infections. Let's talk about respiratory tract infections. Why would that be? Okay. In the respiratory tract, you have this. So the respiratory tract, there's mucus all up and down the respiratory tract, right? Well, the mucus hitches a ride with something called the mucociliary escalator. You know how like you go to the mall or you go to the airport and you get on the escalator and it kind of takes you up? Well, that's exactly what happens with the mucus. The mucus says, "Hey, I need to come up so I can go somewhere." What happens is the mucus jumps on the mucociliary escalator. It takes a ride up, and then when you go and you swallow, you now take that mucus, send it back down the esophagus, you swallow it, it goes down into your stomach, the stomach acid processes, and then you either pee or poop it out, or it comes through sometimes you'll breathe off some of it, or sometimes it'll come through your skin, but it's going to be excreted some kind of way. Well, so, oh, by the way, how do we use this information? You know how you're listening to somebody and they start clearing their throat and they go, okay, what that tells you is that the mucus wasn't that far down because they went and then they were fine. That means that the mucus did not have far to go. They swallowed, it went down the esophagus, they processed it. But then when they hit you with one of these, that means that the mucus was either way down or there was a lot of it. It took a lot longer for that mucus to ride up that mucociliary escalator and for them to get rid of that mucus, right? So listening to how they clear their throat tells you how much mucus they have. That's pretty cool, huh? So when it comes to respiratory, I'm going to talk about the infections in just a moment. But so you need ATP, though, to make that escalator move. And if you don't have ATP, what's going to happen is you're going to be susceptible to a lot of respiratory infections because you don't have a way to move the mucus. So it gets trapped. Now, when the mucus gets trapped, it can lead to things. Now they'll have all kinds of respiratory conditions, more prone to things like COPD, chronic bronchitis, all of those obstructive lung conditions. The other thing is you need ATP to be able to fully empty the bladder, for instance. Well, if you don't have enough, now some of that gets trapped. It can lead to bladder infections, pyelonephritis, things like that. And they'll often have UTIs. So in every chronic situation, they're going to be predisposed to respiratory infections and UTIs. Okay? You can also have things like in the bone marrow. At any given moment, the bone marrow is a site of a whole lot of cells. For instance, in the bone marrow, we have red blood cells, we have white blood cells, we have platelets. Well, if I don't have enough ATP, now I can't make red blood cells. If I can't make red blood cells, what am I going to have? Anemia. If I can't make white blood cells, whether we're talking neutrophils, lymphocytes, monocytes, eosinophils, basophils, it doesn't matter. If I can't make enough white blood cells, now I have leukopenia. So I could have anemia, I could have leukopenia. If I can't make enough platelets, now I'm going to have things like thrombocytopenia. Well, what if I can't make all of them? Now I have pancytopenia, right? So all I'm doing is I'm taking basic concepts and I'm showing you how to apply it in a lot of different ways. And this is what happens in every chronic disease. So they may have, if that chronic condition stays around long enough, they could have bone marrow suppression. That'll lead to all those other situations like anemia, leukopenia, thrombocytopenia, or pancytopenia, okay? They can have things like vasculitis. That can, of course, affect their spleen. I'm going to speed up the process now. But one thing that can happen, of course, another place that we have a lot of turnover is the pancreas. Well, now they're predisposed to things like pancreatitis. The number one, I wanted to just tell you this, the most common cause of pancreatitis in adults, now it's obesity. And so obesity is the most common cause of pancreatitis. It used to be alcohol, but alcohol has fallen to number 2. But it's still a big cause. We can also have elevated triglycerides or hypercalcemia. So the most common causes of pancreatitis in adults are going to be obesity, followed by alcoholism, hyperlipidemia, and hypercalcemia. In children, the number one cause is going to be trauma, followed by infections. The 2 most common infections in children that lead to pancreatitis are going to be mumps and Coxsackie B virus, for instance. And then number 3 and 4 are the same as for adults, elevated triglycerides or hypercalcemia. Now, I want to show you something else. Let's say you don't have enough energy. So we're still talking about what happens in chronic diseases and when you don't have enough ATP. Well, the brain needs ATP to keep itself alive, right? For all these functions that have to occur in the brain. Well, in adults, if you don't have enough ATP, this is what leads to things like dementia. So you have an adult that goes for a prolonged period in a low energy state that leads to, for instance, dementia. Let's say you have a kid that goes without ATP. They suffer from lack of global energy for a long time, and that leads to things like cognitive impairment, cognitive delay. In the heart, if we don't have enough ATP, for instance, so the heart contracts, but we can't relax the muscle, now they end up in heart failure. Okay? And this is actually what happens. In fact, the most common cause of death in every chronic disease is going to be heart failure, simply because you don't have enough ATP. What's the most common cause of death in every chronic disease? It's going to be heart failure. There is an exception, though. Let me just keep going. We're almost there, guys. So, what is the difference between, for instance, a disease and a syndrome? If one organ gets affected, so let's say in the case of diabetes, the original cause is a problem with the cells of the pancreas. For instance, those pancreatic islet cells, either there's a problem with the cells themselves not making insulin, or there's a problem at the receptor level. So that's, of course, the difference between type 1 and type 2 diabetes, whether we're talking about a cell problem itself, where you're not making insulin, or there's insulin resistance. Okay? But it's a disease of an organ, and that organ is the pancreas. However, even in diabetes, you can have all these complications. And that's what we were just talking about. So for instance, let's say you take something like diabetes. Diabetes, though, a diabetic in a low energy state, because they have this disorder now or disease, how's their skin going to be? It's going to be dry, itchy, flaky. How's their hair going to be? They're going to have thin hair, brittle hair, dry hair. Their nails are going to be, they're not going to have healthy nails. Their GI tract, they're more susceptible to things like nausea, vomiting, diarrhea. Okay. In the uterus, they're more likely to have things like endometriosis or uterine atrophy, secondary amenorrhea. In the breast, they're more likely to have breast atrophy. Same for the testicles. In the kidneys, they're likely to have impaired absorption or secretion in the kidneys. They're likely to have respiratory and urinary tract infections, right? But it doesn't matter what disorder. Pick one, and the story is going to be the same. Hypothyroid, hyperthyroid, lupus, any autoimmune condition. The story is going to be the same. So all of those are complications of any chronic disease, because your body is having to use more energy than it has. So you have more demand than you have supply. Okay. Now, I want to tell you about this other thing. So a disease is where one organ gets affected. A syndrome is where more than one organ or more than one tissue gets affected. Now, what are the things that make somebody go say, hey, I need some help? I need to go to the doctor. I need to call 911. The two most common symptoms, or what the patient states, number one is going to be weakness. Number two is going to be shortness of breath. So the two most common symptoms in every chronic disease are going to be weakness and shortness of breath. Why do they seek help then? Because you got to think about it, all right? So let's say they're trying to go to work. Well, when you feel like you're too weak to where you can't even go to work, and that's your livelihood, you got to feed your kids, you got to pay your mortgage, your rent, whatever the case is, that often causes people to seek help. Once they get to the point where their energy level is so low that they're just too weak to function, that's when they seek help. So weakness, and then shortness of breath. When you get to the point where you feel like you can't breathe, you feel like you're going to die, that's another reason to seek help. Okay, so the two most common symptoms are weakness and shortness of breath. The two most common signs, the difference, of course, symptoms are what the patients say. And of course, when we're writing it, we put it in quotes. And then the signs are the things that we are able to see, the objective data. Those are things like tachypnea and dyspnea. Tachypnea, of course, is rapid breathing. Dyspnea is difficult or labored breathing. Now, I want to. So this is the fine, almost there, and then this is it. I want to talk about the infections that happen. Remember, I said the two most common types of infections in every chronic disease are pulmonary infections and UTIs. Well, when it comes to lung infections, for instance, the most common cause of a lung infection is actually a virus. Okay, it's a viral infection, and the most common virus is adenovirus. I was going to go into more detail, but just for the sake of time, I'm not going to go into all of that. I was going to show you this whole connection about viruses and DNA viruses, RNA viruses, but I'll save that for another time. But for instance, adenovirus is one of those double-stranded DNA viruses, okay? It's actually the most common virus. It's the virus that causes common cold, it causes diarrhea, it causes all kinds of problems. But when it comes to viral infections, here's what I want you to know. Most infections are viral. In fact, 92% of all infections are viral. And the number one virus is going to be adenovirus, okay? But if it's not a viral infection and it's a bacterial infection that's causing a lung infection, the top bacteria in order, number one is going to be strep pneumo, okay? Number two is going to be Haemophilus influenza type B, and then number three is going to be Neisseria catarrhalis. So the number one lung infection is a virus, and the number one virus is adenovirus, which is one of those DNA viruses. But if it's bacteria, so 92% of infections are viral infections, and then bacterial, fungal infections, parasitic infections, those make up the rest of the 8%. The reason I tell you this is why it's so important that you don't overuse antibiotics. Most infections are not bacterial. So using an antibiotic causes antibiotic resistance and can contribute to a lot of problems. And see, what happens in antibiotic resistance is the bacteria start to change. They get used to the antibiotics, and now you have to get stronger and stronger antibiotics. Eventually, you've gone as strong as you can go, and now they're susceptible to all kinds of infections. So you want to be very careful. Yes, there are times where antibiotics are necessary, but you want to be careful not to overuse antibiotics. When it comes to bacterial infections, though, the top one is strep pneumo, then Haemophilus influenza type B, and then Neisseria catarrhalis. Okay? Of course, strep pneumo is one of those gram positives, and then let's say Neisseria, that's one of those gram negatives. Now, when it comes to UTI, there again, the number one cause of a UTI is a virus. Specifically, it's going to be adenovirus again. Same one that causes pulmonary infections, causes UTIs. However, if it's bacteria, the top bacteria are going to be E. coli, Proteus, and Klebsiella. Okay? Now, what do we know about those? E. coli, Proteus, and Klebsiella. Those are all gram-negative bacteria that are considered, the reason I have the circle here is just to remind me to tell you that they're nitrite positive. So they're gram negative, but nitrite positive. Okay. However, if it's not one of these nitrite positive ones, then it's nitrite negative, and most likely that's going to be enterococcus. So when you do a urinalysis, you're looking for nitrites in the urine. If you see nitrites, then it's probably, if nitrites are positive in the urine, it's probably E. coli, Proteus, or Klebsiella, and so that can determine which antibiotic therapy you're going to use. However, if it's nitrite negative, it's more than likely enterococcus, which happens to be gram positive. So these are gram negative, nitrite positive. This is gram positive, nitrite negative, okay? So we have covered so much today. We started talking about how the cells need energy. One final thing. And then this is it, I promise. And then we'll just recap, and that'll be it for today. I want to tell you one thing about the organs. There's a pattern here, and this applies in all of medicine. The three most important organs that we're trying to protect at all times, number one is the brain, followed by the heart, followed by the kidneys, okay? This also happens to be the organs that get developed first in embryological development, the brain, the heart, and the kidneys. So when it comes to protection, we're always trying to protect the brain even over other organs. How do I know this? For instance, when we do CPR, somebody is in cardiac arrest. What organ are we really worried about? I just said it. Remember I said we're worried about the brain. Yes, we're doing chest compressions over the heart, but the reason for that is we're trying to get blood circulated to the brain, okay? Think about it. How many times have you seen somebody that their heart is beating, they're laying in a bed in an ICU for months on a ventilator, but they're brain dead? What we're really concerned about is the brain, okay? So the most important organs, always remember, are brain, then heart, then kidney. But when it comes to in a disease state and your body says, hey, I got to let something go, it goes in reverse. So when it comes to sacrificing organs, your body says, hey, I'm going to sacrifice the kidneys first, then I'll sacrifice the heart, and then I'll sacrifice the brain, okay? This is why in every chronic disease, you want to be checking people's urine. You want to check their urinalysis. The urinalysis can tell you a lot of information about things that may have spilled over into the urine to give you an indication that the kidneys are failing, okay? This is also why, for instance, let's say in a heart attack, or we have, heart failure, we can have these enzymes that get released. So this is where things like troponin would come in. So what I want you to know is the order of importance is brain, followed by heart, followed by kidney. But in order of sacrifice, it's going to be kidney, followed by heart, followed by brain. You got it? So here's what we covered today. We covered all kinds of stuff. We talked about how to make ATP. We talked about how to go from glucose to ATP. We went through glycolysis, citric acid cycle, electron transport chain. We told you uses of ATP, why you need it. And then we went over all kinds of things that happen when you don't have it. So in every chronic disease, when you're in a low energy state, you're going to have changes in your skin, your hair, your nails. You have bone marrow suppression. You can have vascular changes with the endothelium. You can affect the uterus and the endometrial layer. The breast, the testicles change. For instance, that's going to lower sperm count. You can have nausea, vomiting, diarrhea. You can have impaired renal absorption or secretion. You can have all kinds of infections and lung infections, respiratory tract infections. We talked about, for instance, if the cells get damaged enough, they will either you have inflammation, and then if you don't correct it, it can lead to cell death. And we talked about apoptosis and necrosis. And then we said the cells can either die or mutate. We talked about the different types of cancers. For instance, we said the most common types of cancer are skin, GI, and bone marrow. And then when it comes to mortality for a male, it's going to be prostate, lung, then colon. When it comes to mortality for a female, it's going to be breast, lung, then colon. Now, I told you that the most common cause of death is going to be heart failure, nearly all the time. In every chronic state, in every chronic disease, the most common cause of death is going to be heart failure. However, there's one exception, and that's going to be in neuromuscular disorders. So think of things like myasthenia gravis, Lambert-Eaton myasthenic syndrome, things like that. Those neuromuscular situations, there, the most common cause of death is going to be respiratory failure. Okay? How is that? Well, for instance, you've got this long nerve here that supplies this muscle called the diaphragm, right? Remember, the diaphragm is that dome-shaped muscle that actually, when it contracts, it flattens. And that's how you're able to breathe. Well, this nerve that supplies that muscle is called the phrenic nerve. Well, in a neuromuscular disorder, what happens is the signal doesn't go from the nerve to the muscle. So calcium gets released to cause this muscle contracts, but we don't have enough ATP to cause this muscle to relax and go back to its original state. So what happens is they take a breath, but they can't relax the diaphragm for another breath. Well, if you can't relax your diaphragm, if you can't breathe, that's called death, right? So we'd have respiratory distress that would lead to respiratory failure, that would lead to respiratory arrest, that would lead to death, okay? So we're going to stop there for today. I hope you learned a lot today. What you saw me do is I just took basic concepts and I took a concept, for instance, in inflammation, and I showed you how in inflammation we have a loss of ATP, and that's going to go and affect the entire body. I hope you learned a lot today. I hope you share this with your friends and family. And I would invite you, if you want to keep learning with us, sign up for the Level Up Medicl Mastermind, where I'm going to be able to go much more in depth. We only have so much time today, but in our Level Up Medicl Mastermind, which is our monthly program, it's a monthly program where it's a monthly subscription, but you're actually learning every single week. And for a whole year, we will be learning together. So I hope you'll consider that. I hope this blessed you, and everybody have a great day.